How you doing? My name is Dr. Rodriguez. I'm in Dallas, Texas. This is my 35th year as a family practice doctor, and 20 years ago I stumbled upon acupuncture fortuitously. These little tools are the most important tool ever created by people to help human suffering. But in my research in the past 5 months, I discovered that this tool was perfected by a group of doctors in the 80s. They combined their knowledge and published what they call myofascial pain and dysfunction therapies. And those therapies include stretching, flexing, massaging, needling, traction, unwinding, Epsom salts baths, retreat, restore, refresh, mind, body, spirit. And when you use that package all in one, it works perfectly. If you take this out, it doesn't work as well. This is the key. This little tool is a key to unlock muscle memory. You unlock muscle memory and then you pull, stretch, traction. Pulling out the knots and the kinks and let blood flow in, and miraculous healing occurs, just like Mother Nature intended it to be. But if you take this out, or you take your fingers out of the equation, and it doesn't work at all, because natural healing occurs within your mind, body, spirit, your totality. And if you treat your totality, chronic pain can be mitigated, eradicated to the point where you are experiencing peace, comfort, joy, happiness, battle ready. Without this and this efforts, these are tools. This is a tool. Then it doesn't work. The only way you can treat a beaten, battered, wounded, broken into pieces warrior is to nurture tenderness, touch, time, and effort. And then Mother Nature does the rest. It's impossible to treat a beaten, battered, broken into pieces individual with a pill or a knife. Now, it's true medications help about 4 categories of diseases: infectious disease, endocrine, metabolic, and some cancers. That's it. I mean, you have to factor in immunizations and vaccines, clean water, hand washing, sanitation, our lifestyles. But when you factor in what a doctor can do for you, it's 1, 2, 3. 1 is everything. 2 are medicines, which you put into the person to help Mother Nature. It's an assistant, it's a seasoning. And surgery, you remove the culprit. So a boil, an aneurysm, stones, intussusception, blockage, intestinal obstruction, to save someone's life from imminent death. So the only time, in general, you use a knife is for 2 reasons. If you pull out your knife, you're ready to kill somebody or save somebody's life from imminent death. Any other circumstance related to pain, using a knife is wrong. Actually, that's fraud, misinformed consent. There's no one on earth who can help someone miserable with just a knife. It's impossible. A bone saw, it's impossible. Glue, auto parts, it's impossible. although people believe it. I used to believe it. I didn't drink the whole container of Kool-Aid, but I always had my doubts. And today I'm absolutely certain. But without this, and without this, I would have not been able to see what this and this is, because you can't see it. It's all feel. So the acupuncture needle, and there's a web of something in here, and I've been treating this for 6 years. So in the past 5 months, I've been able to whittle it down to it bothering me from every 5 minutes, 24 hours a day. You get and it just causes, it takes your breath away. It wakes you up from sleep. The two may be bothering me once a week. And this morning I woke up with a little, that's it. It was like, I said, it's coming back. So here it comes. And the logic behind this is, that didn't even go in. See, it's bending. There's a knot there, and I've been trying to get rid of that knot for a long time. So I'll use a different needle. Some needles are dramatically different. Now you can feel the difference, but this is a Japanese needle. They're a dime a piece, so I tend to use them wisely. And they are a little smoother. Why? It's just technology. But without them, I would have to use a hypodermic needle. There was something there. So everything you feel is reality. What it means, don't know. But your fingers feel, the patients feel, and once you get that feel back, then you'll have an idea. Only an idea. Ooh, that's a good spot. It's an ache. It's a pressure. But I say good, I don't know, because I thought once you find a spot, you were done. No. You have to stir that pot of beans until they become consistent. And how many times you stir the pot depends on what the patient requires. A half dozen times for many people, and 100 times for a few people. The tissue and the patient dictates everything. The ancient Chinese were brilliant, and they knew scientifically it was beneficial. But how do you write down something invisible? You can't. So they did their best with their artistry and mastery. They did a great job. The problem is, when you write down something, someone else reads it, who's not a master, they will read it wrong and send them on the wrong direction. So without a master guiding you for a couple of years, you will lead yourself in the wrong direction. And that's where you go. You go in the wrong direction. That's where you end up. Now, from 97 to about 2007, I was going in circles until a patient asked me, Dr. Rodriguez, move that needle over a little bit. Move it over? Okay, I'll move it over. She says, up, over. Okay, that's it. That's the spot. And then she says, do the violin thing that you say you do. This is the violin thing. If I can grab it, you go in and out. See how it's grabbing and it's bending too. Whoops, that one's bent. Let me try this one. See how that's grab beyond. Sometimes it just, I have to actually yank it out because it won't come smoothly. So that's a sign that the tissue has devolved into stage 5. Stage 5 muscle damage disease is the tissue devolves into beef jerky, and you can feel it. And at stage 5, it takes a lot of work to reverse the damaged tissues. In a young person, the muscles are just locked. All you have to do is unlock them, and they're like, "Whoa, what'd you do, doc?" I says, "I just unlocked the muscle." They say, "It was that quick?" Yes, it's that quick. All you do is release the muscle and stretch it out. Let Mother Nature do the rest. That's it. So there we go. Some of these I can't see because of the, ooh, that one's a good one. So even though I say it's good, it's just that I can feel something. The only way you know that you have given enough benefit to the tissue is immediately after you have feedback, and then 2 days later, 3 days later, 5 days later, when the patient comes back, they'll say, "Great, doc, repeat what you did last time." Once you get that message, then you apply the amount of force, effort, density, frequency, intensity to reverse the process. And the patient will say, "Thanks, doc, I feel better." If the patient doesn't say, "Thank you, doc, I feel better," then I missed something, omitted something, or I didn't give enough oomph. All I have to do is go through the process again. So I'll have patients, after I finish, get up and stretch and walk around and see how it feels. And then if it feels better, great. If it doesn't, great.